Hello everyone. Here we are going to discuss the important topic that is Myelodysplastic Syndrome, also known as MDS. So in your university exam, you usually get a short question, especially on the clinical features, lab diagnosis, and most importantly, the morphology, that is plastic morphology of MDS. So we will discuss these in detail. Myelodysplastic syndrome known as MDS. So let's start it. So first of all, I will let you know the definition of MDS. What is MDS? Then we will see its etiology, then types, clinical features, lab diagnosis, and finally morphology. So if it is asked in long question, rarely it will be asked as a long question. You have to frame your answer under following headings. And if it is asked in a short question, you have to start with definition along with whatever is asked. If clinical features is asked, lab diagnosis is asked, or morphology is asked, you have to club that thing with the definition. So let's start the MDS. Now, I have told you the WHO classification of lymphoma. I assume that you have watched my video on classifications of leukemias and lymphomas. If not, please watch that. So, in the classification of lymphoma, the WHO classification of lymphoma, there are two types of lymphomas: myeloid neoplasm, lymphoid neoplasm. So, WHO classification of myeloid neoplasm and WHO classification of lymphoid neoplasm. Among the myeloid neoplasm, there are 5 categories, and one of the category in the myeloid neoplasm, among the 5 category, one of the categories MDS. That is myelodysplastic syndrome. So MDS is one of the myeloid neoplasm. That is the introduction. Now to understand what is MDS, you must understand hematopoiesis. I guess you know what is hematopoiesis. Hemato means blood cells. RBC, WBC and platelet. Poiesis means their synthesis. So synthesis of all blood cells takes place in the bone marrow. So here you can see there is a bone marrow. Inside the bone marrow, the formation of the blood cells takes place. All blood cells are formed from hematopoietic stem cell. So hematopoietic stem cell give rise to RBCs also, WBCs also, platelet also. RBC don't have any further type. WBCs are of 5 type. That is neutrophil, eosinophil, basophil. These are the granulocytes, and monocyte and lymphocyte. These are the agranulocytes. And platelet don't have any further type. So total RBC, platelet, and the 5 type of WBC. Total 7 cells are formed from hematopoietic stem cell. And after becoming mature, they move in the peripheral blood. Precursors don't go in the blood. In the blood, the mature forms are going. So how does this synthesized in the bone marrow? So from the hematopoietic stem cell, 2 stem cells are formed: myeloid stem cell or lymphoid stem cell. Myeloid stem cell is myeloid progenitor and lymphoid stem cell is lymphoid progenitor. You can see. So myeloid progenitor give rise to RBCs also, platelet also, and 4 WBC out of the 5. That is neutrophil, eosinophil, basophil, and monocyte, but not lymphocyte. The lymphocyte is derived from the lymphoid stem cell. Here you can see like this. So this is the complete how they are formed. Here also the same you can see, here also same you can see. Now let's come on the topic myelodysplastic syndrome, MDS. Now you have understood hematopoiesis. In MDS, the problem is that there is ineffective hematopoiesis. The hematopoiesis is ineffective. I mean, the problem is in the bone marrow. In the bone marrow, the hematopoiesis is not taking place properly because of certain mutation. Which mutation I will let you know. Now, since hematopoiesis is not taking place effectively, so RBC, WBC and platelet are not formed in normal quantity, in normal number. So in the blood, there will be less RBC, that is anemia, less WBC, that is leukopenia, and less platelet, that is thrombocytopenia. The 3 things together known as pancytopenia. Pan means all, and cytopenia means less in number. So in the blood, there will be pancytopenia. That is the second feature of MDS. So in MDS, the first thing is ineffective hematopoiesis in the bone marrow. So first thing you have to learn, the most important, ineffective hematopoiesis. That leads to 2 things. Number 1, in the blood there will be pancytopenia. All the 3 things are less. And number 2, in the marrow itself, you will get dysplastic morphology of their precursors. Dysplastic morphology of their precursors. So RBC precursors, that is erythroid lineage, WBC precursors, that is granulocyte lineage, and platelet precursor, that is megakaryocyte lineage. So all the precursors will have dysplastic morphology, various dysplastic forms. I will let you know a few examples. So that is the third thing. And the fourth thing, MDS have a chance to convert into AML in future. That is acute myeloid leukemia. So what are the four criteria of defining MDS? Number 1, ineffective hematopoiesis. The most important is ineffective hematopoiesis in the bone marrow. That leads to 2 things. Number 1, cytopenias in the blood and dysplastic forms in the marrow. So cytopenias in the blood and dysplasia in the marrow. And there is always a chance that MDS convert into the AML. So these are the 4 criteria of AML. Please learn the 4 criteria of MDS. What are the 4 criteria? Number 1, ineffective hematopoiesis. The blood cells cannot be formed properly. There will be ineffective hematopoiesis due to mutation. That leads to 2 things. What 2 things? Number 1, cytopenia in the blood. In the blood, there will be less RBC, less WBC, less platelet. And in the marrow, there will be dysplastic form. There will be dysplastic form in the marrow. So one thing is in the blood and one thing is in the bone marrow because of